With the COVID-19 vaccine from Pfizer expected to be approved for use in the coming days, provincial governments, Public Health Canada, and the military will run through the plan to distribute those vaccines beginning today. With more on the logistics involved, we're joined by infectious disease specialist Dr. Isaac Bogosh, who has just been appointed to Ontario's Vaccine Distribution Task Force. We recognize you can't talk about that, Doctor, but we'd like to congratulate you and thank you for your service that you've been providing to us and to Canadians throughout this pandemic. Really a job well done, and we know that you'll continue doing a great job. Let's jump right in. There will be a national center coordinating vaccine distribution across the country, but in terms of the logistics of how to move the vaccines and where, that'll be left up to individual provinces to decide. Tell me, what will be the biggest logistical issues to iron out during this dry run?
Yeah, certainly we know that the two front-runner vaccines in Canada are the Pfizer vaccine and also the Moderna vaccine. Now, these are products that need to be stored at very cold temperatures. The Pfizer vaccine is a -70 product. The Moderna vaccine is a -20 product. And the Pfizer vaccine, at least at this point in time, might change, but at least at this point in time, has to be really administered at the site where it's thawed. So there's tremendous logistical hurdles, right? We've got a huge province in Ontario. Canada's a massive place. We've got urban and rural communities. We even have some fly-in communities. We know Indigenous populations are high on the priority list, but some are in more remote locations. So there's tremendous logistical hurdles in keeping a cold chain while sort of adhering to how this vaccine has to be handled in order to give this to the highest priority people.
The National Advisory Committee on Immunization recommended that residents in long-term care homes, as well as seniors over the age of 80, should be vaccinated first. Does that affect the distribution plans?
It sure does, because as we know that this product does not tend to move well. At least that's what we're told up front. Now, some of this might change with time, and I think that we will very likely see some pivoting and evolution of the rollout plans as we learn more and more about this product. But when we think about where long-term care homes are across the country, yeah, some are in big urban centers, but some are in more rural areas. And I think at this point in time, anytime we have to think about how we're going to move this vaccine to various parts of the country that are farther from large urban settings, the challenges start to mount. I think the other important point is that we're talking about some of the logistics related to the Pfizer vaccine. We also know that the Moderna vaccine is likely, I'm not part of Health Canada, but it's probably going to be approved. That'd be my guess. And I think working with that product might be a lot easier than working with the Pfizer product. So all of these have to be taken into consideration. I think both of them will hopefully be available in the near future. And certainly each one poses significant challenges. But I think with the Moderna vaccine, it looks like the challenges will be fewer. And if we have access to that, I think it'll be much easier to spread that out throughout the country.
Doctor, how closely are we watching, say, for example, the UK and their rollout, which begins tomorrow, for everything from who they're giving it to how they're dispensing it? How closely are we looking to adopt best practices moving forward?
Yeah, certainly very closely. And I think most countries who are on the brink of rolling out vaccine programs are all watching each other very closely to see what models work and what models might not be as helpful. I think the other really interesting thing is when you look at how countries have prioritized their target populations, the high priority populations, most countries have done that in a very similar manner. It's not exactly the same, but there's a lot of similarities. So it's just kind of interesting when you have several groups in several countries independently coming up with mechanisms to roll out vaccine programs. It looks like they're all looking at the same data and coming up with the same conclusions or similar conclusions independent of each other. So, there's probably a few right ways to do this. There's probably clearly a few wrong ways to do this, but it's clear that there's going to be several right approaches to this.
Doctor, thank you so much. Congratulations again. We'll talk to you soon.
Thanks so much. Have a great day.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.